I have some exciting news. So a few days after the last video was released, I found out that not only was my hospital getting almost 2,000 doses of the Pfizer vaccine that we had just talked about, but that being a doc who takes care of people on the inpatient side, that I would be among the first of the employees to be able to get it. I found out the night before, and as you could tell, day of, I was quite excited.
All right, here we are, downtown Minneapolis. It is a balmy 37 degrees out. And as my dad used to say when he was really excited about something, this is a great day for America. Let's get after it.
I did show up 20 minutes before the vaccine clinic was scheduled to open, thinking that I wouldn't have to wait very long in line. I was quite wrong. There were easily 100, 150 people already in line. And this was one of 3 sites that was going on simultaneously across the hospital. I have never been happier to wait 2 hours for something in my entire life. It was really touching to see docs, nurses, therapists, social workers, clinical coordinators, everyone coming together to get this vaccine. There was a lot of excitement amongst my coworkers. It's been a slog. There's just no two ways about it. And to finally have something that just felt like such a relief, and that it happened so quickly, there were a lot of emotions. There was definitely a lot of happy emotions. People were singing, people were playing music, people were clapping.
How do you feel?
Amazing. It's working right away, right?
The immune system is just like going into overdrive.
There were tears. People were also crying. I think tears of joy for actually getting to this moment, but certainly tears of sorrow that this was a moment to feel happiness. We've watched a lot of people die over the last year, and it's hard to not.
Thank you so much for your work today.
You're welcome.
I cannot tell you how forward. Yes. Not only. Did you? I was like, there's a 20% chance I'm gonna bust out into tears. Side effects. Tears of joy.
As far as my own personal experience,
So you will have to get a second one.
Yep.
17 to 21 days.
Perfect.
They will let you know because you have got to get Pfizer.
Okay.
You cannot cross over to the Moderna.
Got it.
So I'm going to give you a card.
Okay.
And what I'm suggesting is people take pictures of it so that they have a record of it
That's a great idea.
in case you lose the card.
Yep. I will absolutely do that.
Okay.
Thank you so much. You have a wonderful day.
Thank you.
the vaccine didn't hurt. I didn't have any symptoms right away. I felt totally normal. I got it Friday afternoon. The rest of Friday was totally fine. I didn't sleep particularly well, but I think that had more to do with my wife getting called in to do an emergent surgical case in the middle of the night as she was on call this weekend than had anything to do with my vaccine. Saturday morning, I definitely felt like I had been punched in the arm pretty hard the day before. It didn't bother me, it didn't limit me in any way during the day, but when my 4-year-old bopped into me, I felt it. Today, Sunday, it had completely gone back to normal. As far as local manifestations, like we talked about last time, I didn't have any redness or swelling. And as far as systemic or total body symptoms, nothing. So I'm happy to report that in my last video, my expectations of what I was going to experience came to pass. That was true. A little bit of pain, and within 2 days, it's gone. But of course, that's not going to be everyone's experience. No sooner had the vaccine started to roll out over the past week than we started to see news reports about severe allergic reactions. This particular type of severe allergic reaction is called anaphylaxis. This is where mast cells and basophils, which are 2 cells that live in your body, release their contents and cause a total body allergic reaction. The scariest part of this is for people who experience swelling in the neck and throat that can be very dangerous for your breathing. Doing a quick search, I came across an article from the New York Daily News. They were reporting 6 cases of anaphylaxis over the past week in the United States after administration of 272,000 vaccine doses of the Pfizer vaccine. Anaphylaxis to a medication or drug-induced anaphylaxis usually happens within seconds, if not minutes. And on the form that I had to fill out beforehand, it asked whether I had had allergic reactions to the ingredients, and then it would list them out of the vaccine or to other medications. If you answered yes to any of those questions, they still allowed you to get the vaccine, but they wanted to monitor you for a period of time depending on your risk factors, which that makes sense. That's a pretty safe thing to do. So what I don't know is if those patients who had anaphylaxis to the Pfizer vaccine, if they had a history of anaphylaxis, because that's an important point, right? If patients who have had a history of anaphylaxis are going to be at increased risk of anaphylaxis, that's important to know. And it's also important to know if these were first-time offenders, if this is the first time these 6 people had ever had an episode like this. Humans are inherently very bad at assessing risk. Now, I'm not trying to minimize what these 6 people went through. Anaphylaxis, as someone who's taking care of it, is very scary and it is life-threatening. But before anyone stands up and says this vaccine isn't safe and this is experimental, we need to take a step back and just look at the bigger picture, the 10,000-foot view. In the phase 3 study that we went over in the last video, there were around 18 or 19,000 people who received the vaccine. In the past week, there have been at least 272,000 people who have received the vaccine. And I saw reported that there were nearly 3 million additional doses set to ship this week. So we are dealing with orders of magnitude more people who are now receiving the vaccine than received it during the phase 3 trial. So with 6 cases and 272,000 vaccine doses, that equates to about 1 in 45 to 46,000 people who need to get the vaccine to have 1 episode of anaphylaxis. That's a 0.002% chance of anaphylaxis based on this preliminary data. And again, as another 2, 3, 4, 10 million people get this vaccine, those numbers might change. But we're talking extraordinarily small numbers right now. But let's talk about COVID-19 and SARS-CoV-2 virus. What has that done in the United States in the past week? According to the Johns Hopkins COVID-19 dashboard, from December 11th to December 18th, there have been an additional 1.6 million people, million Americans, who have tested positive for COVID-19. An additional 18,000 have died in the past week. So am I taking those 6 patients that had anaphylactic reactions to the vaccine seriously? Yes. We need to be vigilant and notice any new trends that we didn't see in the phase 3 trial data. This is where post-market surveillance comes in. Any new drug or treatment that is released and studied isn't going to find every single side effect or isn't going to recognize every single pattern or certain specific risk factors that can be dangerous for patients to take it. If we held studies to a standard to know all of this before things were released, we would have no new medications. That is an impossible task. Those studies would be too expensive, too cumbersome to be able to actually perform. So to help do your part to contribute to the knowledge base of how this vaccine affects larger population groups than is feasible to study, you can sign up for the CDC's vSafe. This is an after-vaccination health checker. I just did it earlier today. I'll link in the description below. Again, post-market surveillance is something that's done in every drug, in every new treatment that is released. And in a medicine that we're going from having 0 people experience to tens of millions in a period of weeks or months, this is going to be really important to continue to learn, again, how this vaccine and other vaccines that are going to be used impact larger groups of populations than were studied. I'm also going to link in the description a review article on drug-induced anaphylaxis. This is from the journal The International Archives of Allergy and Immunology that was published earlier in 2020. Now, this is an article that every physician I'm just kidding. I had never heard of this article, but it is a nice review article. A review article is a study that takes a whole host of other studies and tries to condense all of the high-yield learning points, the important aspects of those studies, into a single place, into a single document. The learning points that I took away from this study after reading it were a couple. Number one, that it's estimated the lifetime prevalence of an American experiencing anaphylaxis is about 1 in 200 to 1 in 50. So a 0.5 to 2% chance. And the most common offender of drug-induced anaphylaxis is antibiotics, particularly penicillin or amoxicillin. NSAIDs, or nonsteroidal anti-inflammatory drugs like ibuprofen, were the cause of about 10% of all drug-induced anaphylaxis, and opiates were just around 9%. They also made the point that it's estimated 1 in 3,000 hospitalized patients will experience drug-induced anaphylaxis. Comparing that to the data that we have available to us right now is that about 1 in 45 to 46,000 people who have received the Pfizer vaccine experienced anaphylaxis up to now. Compare that to 1 in 3,000 hospitalized patients. It's far more likely, based on these numbers, that you would experience anaphylaxis from one of the many medications that you would receive while you were admitted to the hospital than you would from this Pfizer vaccine. It's worth repeating, since the rollout of this vaccine over the past week, we have had an additional 1.6 million Americans test positive for COVID-19, and 18,000 Americans die from COVID-19. So I would highly encourage you to not panic when you see something that sounds or looks scary on cable news. You need to take this information within the greater context of everything else that we're dealing with here. And I don't want to get into mortality rates or case fatality rate. That is a video in and of itself. But suffice it to say is that if indeed the rates of anaphylaxis for this vaccine or other vaccines is around 0.002%, that is significantly lower than the case fatality rates of people who contract COVID-19 and die from COVID-19. We also have to take it into the grander context of every other aspect we're dealing with. This is complex, there is nuance, and this is why we're doing this series. We need adults in the room to be thoughtful and to think through these things together. All right, that's gonna do it for today. If you like the video, I guess it helps to hit a like. I have no idea how that actually impacts anything. If you don't know me and want to see future videos, definitely hit subscribe. But most importantly, if you have questions, put them in the comment section. The whole point of this is I want to be a resource for people. I want to address those misunderstandings and misinterpretations and work against all of the loads of false information out there. All right, thanks again. Stay safe out there.